Hello, everyone. Good afternoon. My name is Thea Guerin. I'm a director at the Urban Institute, and I lead the organization's financial well-being research team. I am so pleased to welcome you today to today's discussion, today's event, which will focus on strategies to improve households' financial well-being and enhance upward mobility in communities across the country. Before we get started, a few quick housekeeping remarks. Today's event is hybrid, so we have attendees joining us in person here in the room, as well as online. Welcome, everyone. The event is being recorded. The recorded will be posted online on Urban Institute's website in the coming days. The biographies of each of today's speakers, as well as their slides, are available on Urban's event page as well. Live captions are enabled for virtual attendees. For those of you joining virtually, you can turn off the captions if you'd prefer not to have them online. And virtual attendees can submit questions using a form that our events team will share in the chat. For those of you in the room, when we get to the Q&A portion of the discussion, you can submit questions using the QR code on your tables. It will take you to a form, and we encourage you to submit questions that way as well. Before we get any further with these opening remarks, I would like to take a moment to thank our incredible funders, PNC Bank and JP Morgan Chase, for their generous support of today's event. We are so deeply grateful for your support and for your partnership. We're also grateful to all of you, to those of us who have joined us in person and online for today's conversation, which really comes at a critical moment in our nation's history. Amidst ongoing inflation and historically high living costs, millions of households in the United States are struggling to afford everyday living expenses. The cost of food rose 23% between 2020 and 2024. The cost of eggs has doubled in the past year. Rents have gone up by more than 50% in the past decade. And the price of childcare, healthcare, and other necessities, which was already high, has also increased in recent years. Now, I want to be very clear that these trends are not a symptom of recent disruptions in Washington, D.C., nor are they the result of a single administration's policies or actions. People in countries across the globe are grappling with the ongoing effects of the cost of living crisis. And yet, we must also acknowledge that the context in which households are navigating these challenges looks very different today than it did just a few months ago. With the onset of tariffs, declining consumer confidence, economists are noting an increased likelihood of a recession occurring in the next couple of months. And at the same time, proposed cuts to government aid programs mean that people could have less of a safety net to fall back on in times of need. We should also acknowledge that the context that we as researchers, practitioners, policymakers, and community leaders are operating and are navigating has also changed. It also looks very different now than it did just a few months ago. Many government agencies are navigating the challenges of a significantly reduced workforce. Cuts to federal grants have dramatically altered the nonprofit funding landscape, and access to some public data sets that we have traditionally relied on has become more tenuous. Despite, though, this changed context, the fundamental economic challenges that everyday Americans face remain the same. So today's event gives us an opportunity to take a deep breath, to pause, and to take stock of the current realities of Americans' financial lives, to come together to consider such questions as what economic challenges are we as a country currently facing? What can we do to address these challenges? And in this particular moment, how can we collectively create the conditions in which all people in America can thrive? So here's how we'll spend our time together this afternoon to begin to answer those questions. In just a moment, I will welcome my urban colleagues to the stage to share insights about the true cost of economic security in the United States, based on some really impressive research that Urban recently released. After that, we'll have a panel discussion with practitioners, advocates, and innovators who will shed light on the drivers of households' financial security and identify solutions to improve financial well-being. After a quick 15-minute break, Urban's president, Sarah Rosen-Wortel, will share a few remarks about how the Urban Institute and our partners are meeting the current moment. And we'll then conclude with a panel discussion featuring leaders from across the country who are working to advance solutions to improve upward mobility in their communities. For those of you joining us in person today, I do hope you will stick around for a networking reception that we'll be hosting just outside these doors after the event. So with that, thank you all again for being here. It really means so much to us to have you all as part of these conversations. And I'm so pleased to welcome my colleagues Miranda Santillo and Ilham Derry to the stage.
Hello, everybody. Thank you, Thea, first of all, for your remarks, and thank you to everyone who is joining us either in person in the room or virtually online. My name is Miranda Santillo. I'm a policy program manager here at the Urban Institute. I work primarily with our financial well-being practice area. I'm joined with Ilham, my colleague here at the Urban Institute, who is a lead researcher on the true cost of economic security, which we're going to dive into that a lot more in detail during our discussion today. I'll pass it over to Ilham for any opening remarks.
Thank you, Miranda. I'm really excited to be here today to talk about this research. Before we get started, I'd just like to acknowledge the work of the broader True Cost of Economic Security team at Urban. This research is the product of a lot of work from the team, as well as the organizations that supported and funded this work, the Federation of Protestant Welfare Agencies and the Community Service Society of New York.
Awesome. So last November, the Urban Institute released new research on the true cost of economic security, which was a comprehensive measure that captures what it truly takes to fully participate in today's society and economy. And unlike traditional poverty measures, the true cost of economic security really accounts for the expenses that are often overlooked but critical for economic stability. Ultimately, the research establishes a threshold that defines what it means to be economically secure today. So, Ilham, as a lead researcher, I'm hoping you can walk us through a bit of what the true cost of economic security really measures.
Yeah, so our goal with the True Cost of Economic Security was to develop a measure that can compare families' costs and resources and then determine whether they have the means to attain economic security. So with this measure, we really wanted to understand what it would take not just for families to survive, but for them to thrive in today's economy. And we found that 52% of families, so over half of people and families in the U.S., did not have the resources to thrive in 2022.
52% of people is not a small number. That's more than half of Americans. So I'm excited to be digging a bit deeper into what does that really mean and who are we capturing in this measure. Before we explore some more of the findings, I want to take a quick step back. Can you share how this work originated and why it's important for policymakers or decision makers to consider measures like this in their work? More specifically, would love to hear how this measure in particular adds to the existing field of economic research.
Yeah, so we have traditional poverty measures, and they're helpful. They're widely used for setting benchmarks for social assistance programs and for better understanding the share of families that are just barely getting by. But there's still a large group of people who aren't necessarily experiencing poverty, but they still feel like they are struggling financially day to day, and traditional poverty measures really miss those families. So with the True Cost of Economic Security, we're hoping to build on traditional poverty measures as well as other measures of economic security that have been developed, while also factoring in some additional resources or costs that other measures don't factor in order to get a better picture of what it would take for families to thrive. And when I say thrive, I'm probably going to use that term a lot throughout this conversation. We don't mean that a family just has a roof over their head or some food on the table, but hopefully they can afford high-quality childcare, they can start paying down their student debt, and even save for the future.
All of those components, and I know we have a slide in a little bit that breaks down what those components are, but I just want to note that I'm really excited that savings is a core piece of the costs that are considered in this measure. We know from the Federal Reserve that in 2022, 54% of Americans reported that they wouldn't be able to cover an unexpected expense of $2,000. So to capture that in this measure is really important, and I think that will be reflected in some of the numbers we'll share in a bit. We know that conventional measures, like you mentioned, the federal poverty rate, captures only the acute financial needs, but overlooks the millions of people who are really struggling to manage their day-to-day finances, even if they're technically above the poverty line. I think that's why we're seeing across the field people move towards broader frameworks such as financial well-being, economic security, upward mobility. All of these frameworks will come up in today's discussions. So just want to note that this measure really complements those frameworks by taking a more holistic view of people's financial lives. So can you walk us through some of the methodology that was used to build this measure?
Yeah, so to do this, we needed to understand a family's costs and their resources. So on the cost side, we used publicly available data on various expenses. So that includes housing, healthcare, food, transportation, childcare, savings targets that we set, student debt payments families might have, taxes and other miscellaneous expenses. And we use those expenses to generate true cost of economic security threshold. So you can think of the true cost of economic security threshold as a family's total costs. And then we pair that with data from the American Community Survey, which we enhance using ADIS, which is Urban's analysis of taxes, transfers, and income security microsimulation model. And ADIS really allows us to get a more detailed look at a family's resources. So here I just have a big blue bar to show resources, but there are a lot of different things that make up resources. So that's a family's earnings, the value of tax credits, the value of health insurance that is provided by an employer, even the value of having a parent stay home to be able to provide childcare.
Wonderful. So this research really breaks down, I think we'll have a slide in a little bit that's going to show us by age groups and family types. I also want to note that the report that I think will be shared in the chat for folks that are online also breaks down the analysis by race and ethnicity too, so for folks that are interested in digging deeper into what some of these findings are. But can you walk us through how the new report that was recently released applies this measure to local geographies?
Yeah, so once we have costs and resources, we can create individual thresholds for each family based on the location and their family composition. And then we can observe the share of families that don't have the resources to meet costs. So that's families with a gap between their total costs and resources. Those are families that can't meet the true cost of economic security. And then when we look at those gaps, we see a few things. We look at families who have a gap between their costs and resources. So one is that healthcare and housing, those are big expenses across the board, no matter where you are. And for families with children, childcare is also a major expense. And then even though there is some consistency in the expenses that are the highest, we do see variation across different family types and locations. So this graph here is showing the share of people and families with resources below the true cost of economic security by family type. So again, over half of all people had resources below the true cost. But we see that's even higher for people and families with children present. Kids happen to be expensive. And it's slightly lower for families where there are no children present and for families with older adults. And we've also made true cost of economic security data available at the state and county level. So at the state level, we see substantial variation across the country. At the high end, we saw that 66% of people and families in Hawaii did not have the resources to thrive. And that's compared on the low end to North Dakota, where 40% of people and families didn't have the resources to meet the true cost of economic security. So there's substantial variation, but all states have a significant share of families that aren't quite in poverty, but still aren't able to attain economic security.
This is really interesting, and I think the variation across places is, personally, I think the most interesting aspect of this research, perhaps because my background is working in local communities to drive economic opportunity. But I think it's especially important for leaders who are looking for solutions or particular programs that they can deploy in their communities to have meaningful change. So can you tell us a bit more about the families who aren't meeting this threshold of the cost of economic security?
Yeah, so for families who aren't meeting the threshold, so that's families who have a gap between their costs and resources, it is interesting to look at how much would it take to get them above that line. So are they short by $100? How much are they short by? So this graph here is showing the average annual resource gap for people and families with resources, so anyone that's below the true cost threshold, and we're looking at just the 15 states with the largest gaps. So again, we see Hawaii at the top of that graph with $46,000. So that means families in Hawaii who can't meet the true cost of economic security on average are falling short by about $46,000 annually. Yeah, so here's a whistle. And there's variation among the top 15 states, but Alaska's right up there, 42. The national average, just for comparison, is about 31,000. And then this second graph is just looking at the other end. So these are the 15 states with the smallest gaps. So even in North Dakota, which had the lowest true cost of economic security rate, families in North Dakota who were couldn't meet the cost of living were falling short by about $23,000 annually. So it's important to think about what this means for families. So if they're falling short, what are they doing to get by? Are they taking on debt to meet these needs? Are they just foregoing certain expenses? So just foregoing health insurance altogether, or finding different ways to make ends meet? So how are they finding ways to stay afloat?
Yeah, this is all really interesting, and I heard somebody in the audience give a woo, and they saw the number. I just wanted to confirm one thing on the methodology. When we're looking at the state level analysis, it's not that there's one threshold set for each state, it's that you're looking at individual families within a state and then doing the analysis from there. Is that correct?
Yeah, that's exactly right. So there isn't a single threshold per state. So it's not that families in New York have to have $100,000 a year. It's dependent on your location and the characteristics of your family.
Wonderful. So you've highlighted some of the key variations at the state level. I was particularly struck when going through this research to find that some states that have a higher cost of living, such as Connecticut, for example, actually had a smaller share of families who were struggling to meet that threshold. I think it was only 45% of Connecticut families lacked the resources they needed to thrive, which might contradict when you think about the high cost of living. So can you share more about what the main drivers of these differences might be across different states and geographies?
Yeah, Connecticut is particularly interesting because they had one of the highest cost thresholds of all of the states, and still they had 45%, still a lot, but relatively low compared to the national average in terms of the share of families who couldn't meet the cost of economic security. So high costs play a role, but they aren't the only factor. And I think when you see Hawaii at the top of the list especially, it's easy to think that that it's high costs that are driving these differences between states. And they do play a role, but if they were the only factor, then we would consistently see that high-cost areas have a higher proportion of people who can't meet the true cost of economic security. But that's not the case. We see a mix. So even some states with lower costs on average have a large share of people and families who can't meet the true cost of economic security. So again, looking at this map, I can pull out two states here. So Louisiana and Mississippi, those two states have some of the lowest cost thresholds when we look across the states. And they're also, I think we know them as lower cost of living states. And still in Louisiana, 56% of people and families did not have the resources to meet the true cost of economic security, and 58% in Mississippi. So it indicates that families, it's not just cost, but having particularly low resources plays a role here. And resources, again, includes things like a family's earnings, the value of benefits that they receive. So it points to state policy choices as well as being a potential factor here. So I mentioned initially that healthcare is a really big expense for families, and housing in a state that provides some additional subsidy or maybe expanded Medicaid. Fewer families have to deal with the high cost of health insurance. And in states that have maybe their own child tax credit, because kids are so expensive and childcare is expensive, then that can potentially offset the higher expenses that come along with having children.
Very interesting, and I'll note that a lot of the findings you just shared, particularly around the policy initiatives that may or may not contribute to the gap in resources, aligns with some of the other trends we see in Urban Institute's other financial well-being research and data. For example, our analysis of credit bureau data through our Debt in America dashboard shows that the southern region of the country is more likely to have residents who are facing this higher burden of debt, and this aligns with lower rates of health insurance or fewer states that have Medicaid expansion. We've also seen that local leaders, when they have this local financial well-being data, they're able to really directly inform their policy solutions to hopefully make up for those gaps. So we've seen, for example, continuing on debt, how local leaders in states and counties have leveraged debt data about their geographies to advance consumer protection policies or to offer medical debt relief programs and things like that. Beyond debt, we've seen how local net worth, emergency savings data has informed local cities who are driving financial empowerment programs in their local communities. So it's just exciting to see more data on the table for local leaders to use as a resource to advance their work. So given this, I'm excited to hear how local policymakers have been using this data, this true cost of economic security, as a measure to inform their work.
Yeah, so we hope that states can use it to better understand the gaps and needs of their population. So what are some of the biggest costs that families in your community are facing? And what are some of the resources they're lacking? And what are the potential solutions for getting them access to those resources? And then hopefully designing some tailored solutions to address those challenges. And one project that I'm particularly excited about is ongoing right now. So we're working with New York City to adapt the true cost of economic security. So we're using this framework to create a New York City true cost of living measure. And we're factoring in some additional costs and resources that are specific to New York City. And hopefully that's going to be used to better understand the circumstances of families there. So it's exciting that it's being used in this way. And then when I think about looking forward to the future, it's really interesting to me to think about using the true cost measure to look at what if scenarios. So how might the true cost of economic security vary based on different policy choices? So what might happen if your state had more affordable rental units or expanded subsidies for housing? What if you raised or lowered the minimum wage? What would happen to the true cost of economic security in your state? Or cap the cost of childcare. I can think of a million different policy solutions. I'm sure you all have a lot of policy solutions that you would want to see and how it could impact families. And we, of course, would love to work with you to figure those out and figure out how they impact families in your states and your communities. Because this true cost measure and then also the Urban's microsimulation abilities are just really well suited to help states and policymakers better understand the issues that are impacting their communities.
It's all very exciting. I think New York City is a good example because I think people often hear New York City and it's like an anomaly to the rest of the country. I'm from upstate New York. It's an anomaly to my experience. So there being a way to focus the insights that we get from this research to a particular area or to look into particular policy solutions is just exciting. And you're right. I also have a million questions that we could ask with the modeling. So soon you're going to hear from a couple of other panel discussions that will dig deeper into some of the broader drivers of economic security and policy solutions that they're exploring or deploying in their own work in their communities. Before we transition to those panels, we do have some time for a few questions from the audience. So if you're in the virtual room, there should be a Google form that was shared in the chat that you can access to input questions. If you're in the real room, there's a QR code on your tables that you can scan to input questions for myself and Alam. We have a couple already, so I'm going to get us started on some questions, but a reminder to please submit more questions. Okay. First question. Are there any costs in the measure that you would have liked to capture but weren't able to? I know you mentioned a lot of the primary costs that typically aren't measured or captured in these types of measures, but are there other costs that you weren't able to capture?
Yeah, so, I mean, we capture a lot, and it was really exciting to be able to factor in savings for families in particular. Something that we didn't look at that we're hoping to be able to adapt the TCS in the future is to look at the costs associated with having a disability. So families, people in families that have disabilities, they have caregiving costs, they might have medical expenses or specific transportation needs, and we're missing those higher costs right now.
Very interesting, especially when you look at not only geography, but also people's experiences, like those who have disabilities.
And caregiving is a huge expense, so it would really change the true cost of economic security for those families.
So speaking of childcare, there's another question here. You had mentioned earlier that I think it was in the resources category, or maybe it was in the costs, that you consider families who have a parent that might be able to be home and they don't have to face the cost of childcare. Can you explain more about how you incorporated that into the measure?
Yeah, so on the cost side, we have the cost of what childcare would be in your area for your family for the ages of children you have and the number of children you have. And then we can factor in resources, like we know if families are receiving childcare subsidies. But then there are some families who maybe have an adult staying at home to provide care. So we have to make some assumptions there. And one of the things we do is if a family has a working adult and a non-working adult who doesn't have a disability and appears to not be working or doing anything else, then we assume that person is providing childcare, and so we offset the cost of childcare for that family. So we're capturing the value of that home production, and we do something similar as well for. I know questions about childcare, but we do something similar for health insurance when we're looking at the value of health insurance. We do not try to put a price on Medicaid. That's priceless. It's very difficult to do, but we know what the cost of health insurance premiums for like a solid plan in your area is. And so if you have Medicaid, so if you're receiving a Medicaid benefit, we fully offset the cost because you have your premium essentially covered.
Very interesting. You're noting a lot of different either costs or resources that I'm sure are coming from a variety of data sources. So a question here is, could you share the data source used with the ACS data to develop the measure?
The data source used with the ACS data?
That's the question, and perhaps this is where you can speak more about the way that the ATLAS model is.
So the data underlying this analysis it's the American Community Survey. It's a nationally representative survey. And so with that, we're looking at all of these households, and the ACS has a lot of information on people's income, whether or not they have a disability, their age, all of these characteristics. And also has information on the receipt of certain safety net benefits. But we know that there is underreporting in the ACS of these programs. So because we use ATLAS, our microsimulation model, to enhance the ACS data, we're able to correct for the underreporting of lots of different safety net programs like SNAP, subsidized housing, child care subsidies, and get a more accurate picture of families' resources that way.
Excellent. This next question, and we have an answer to this one. So are the thresholds provided at the county level? And if they're not, will they be in the future?
Yeah, so we have not, there isn't a specific threshold for a specific county, for a specific state. It depends on the family size. So we do publish on Urban's data catalog. You can go and look, and we have state, county, and national level data. And we provide the costs, the median costs, and median resources, and the true cost of economic security rate. So the share of families in that area who don't have the means to attain economic security for a particular family type. I believe that is a family with 2 adults, 2 children, but it is a specific family type. So we publish some of the data. If there is specific interest or requests, we'd love to hear about what folks are interested in, if there are specific family types or groups or locations that they're looking at.
Awesome. And so just to clarify, the data that's available on the data catalog, is it just for the national level currently?
No, so we have county, state, and national level data available.
Just for a particular family type?
Yeah, for a particular family type.
Excellent. I just had a question come through that I was excited about. There it is. Are you aware of any initiatives that ask community members themselves to define economic security or economic mobility and what that means for them? This qualitative data would be very insightful. At Urban, we agree that the qualitative insights from folks on the ground is really important to test the data and the numbers and the quantitative analysis we do. So I'm hoping you can share more about some of the engagement you all did with folks with lived experience throughout the creation of this report.
Yeah, that's a great question. So it is really important to have the perspectives of folks with lived experience, so the folks who are struggling financially. So one of the things that we did when developing this measure is we pulled together a lived experience panel, and we sought feedback on the costs and like, do these costs make sense to you? Are these the costs? Like, are we missing anything? Disability is one of the things that we received feedback on. And then also when we had the data analysis complete, we presented that, and does this feel right? Does it feel right that half of people don't have the resources to thrive? And the feedback that we got was that it felt true to the experience of folks.
Yeah, and just to clarify, when you all engaged with those community members or those people with lived experience, was that in one geography, or do you think that captures the variation we saw in the research today?
We tried to get a representative group of folks to understand their lived experience.
Awesome. I think I'm going to do one more question before we leave the stage and transfer over to the panelists. But can you talk about, when you talk about the importance of high resources in bringing down the true cost of economic security rates, is it primarily public resources, or is it from both wages, or is it both?
No, yeah, so wages for sure, like that has an impact on true cost of economic security. And then, so I noted public benefits before because that does play a role, and if families, it's another potential policy lever that can be used. You can, of course, try and raise wages, that there are efforts to increase economic opportunity in areas, and that could improve families' economic security. But another option is ensuring families have those resources like in a more targeted fashion.
Yeah. Wonderful. And hopefully this type of data, especially the geographic level, can help to target what that amount is or what type of benefit would help fill that gap along with wages. Well, thank you so much, Ilham. This was exciting, and I hope this was just a teaser for the audience to dig deeper into this research and these insights. I'm going to invite Thea back onto the stage to introduce our next panel.
Thank you.
Well, thank you, Miranda and Ilham, for those wonderful remarks, really fascinating research and really nicely explained. Excited to be back on the stage to continue this conversation with these experts that you see on stage. They represent researchers, advocates, innovators, practitioners, who are here to help us build upon some of the insights you heard in the last research presentation. So starting at the far end of the stage, we have Melissa Botella, Vice President for Income Security and Childcare / Early Learning at the National Women's Law Center. Next to Melissa, we have Jimmy Chen, founder and CEO of Propel. Next to Jimmy, we have Tanya Lada, Senior Director in the Solutions Group at Jobs for the Future. And we had a fourth panelist who was supposed to join us today, Sasha Gay Angus, CEO of Mana Inc. She unfortunately is unable to join us. She was here to speak about housing costs. So I'm going to do my best to represent her perspective, to share some recent insights from urban research on housing. With that, I would like to begin by asking our panelists to reintroduce themselves, tell us, a little bit about their organizations and the work that they do. So why don't we just go straight down the line? Tanya, let's begin with you.
Yeah, thanks, Thea, and thank you to the Urban Institute for hosting us and this event, and congratulations on the release of this research. I'm excited to be here. Like Thea mentioned, I work at Jobs for the Future. We're a national nonprofit that for the last 42 or 43 years have been working to transform U.S. education and workforce systems to drive economic mobility for more people in their communities. Within Jobs for the Future, I sit within our Center for Population Strategies. So we take a population approach to understanding the unique and specific experiences that different learners and workers face as they navigate both our education and workforce systems.
Hey everyone, I'm Jimmy Chen. I'm the founder and CEO of Propel. We're a tech company that focuses on low-income Americans who use the social safety net. We build an app that is used by more than 5 million households across the country each month to manage their SNAP benefits. And a lot of what we do is think about how do we connect safety net programs together to make them more usable and more accessible for low-income families. We are a for-profit company. We were founded through a nonprofit fellowship back in 2014, and we're funded through a mix of philanthropic and venture capital.
Melissa Boter. So I'm with the National Women's Law Center, and we pursue gender justice in the courts, in public policy, and in culture change, so that we center the women who are most directly impacted and face multiple and intersecting forms of discrimination. My team in particular focuses on making sure that women and families have the supports that they need to thrive. That includes childcare and early learning, but also housing, tax credits, nutrition assistance, et cetera. So very relevant for today's conversation.
Exactly. You can see why these folks are joining us on stage. So I'd like to begin right where we left off. I'd love to hear from each of you about some of the insights shared in the last presentation that resonated with you, if anything surprised you, and what additional insights you would add about the various drivers, both on the cost side as well as on the resource side, the drivers of economic security in the United States. Jimmy, I'm going to ask you to get us started, if that's okay.
Sure. To me, one of the big takeaways from the research is how thin the margins are for so many families in the United States. And for the people that we serve at Propel, that's not really a surprise. All of our users are currently getting SNAP benefits. To qualify for SNAP, your income has to be below 130% of the federal poverty line. And so the people that we serve on a day-to-day basis are sort of folks that have fairly consistently been in the TCES population. But there actually is a recent and growing trend that we've been really focused on over the last 18 or so months that has really been impacting the financial security of low-income Americans, and that is the theft of SNAP benefits. This comes about in large part because criminals often target the forms of payment that are easiest to steal from. And as a lot of consumer payments have moved over to chip cards since the pandemic, the EBT card, which is the card that food stamp or SNAP benefits are distributed on, is now the largest and most popular mag stripe card that's still left in the United States, where you have to swipe the card at the terminal in order to pay. And so what criminals have started doing is creating these card skimmers that they're attaching to terminals that is allowing them to steal SNAP benefits. It's happening at a rate of about $400 million per year in food assistance that's being stolen. And perhaps the most consequential part of this is in December, the funding that was at the federal level to reimburse stolen SNAP benefits has gone away. And so if your SNAP benefits are stolen at this point, you just don't have that money. And so when we look at the TCES research and think about the cost of food, the cost of housing, we're talking about families that are really operating on very thin margins, that they're having their SNAP benefits stolen, that there's no replacement opportunity for them, and that it's coming about because the payment technology, the actual card itself, hasn't been modernized in order to prevent that theft. And so this is a big trend that we are seeing in recent months. The good news is we actually think it's fixable, and there are some fairly straightforward solutions we can implement to address the issue. But I think it's to me an example of when we look at one of the different subsectors, when we look just at food, there are these major external events that can really impact financial security of low-income households.
Absolutely. I look forward to hearing some of the solutions in a moment. Melissa, let's go to you next.
So I would echo what Jimmy said in terms of it's not surprising, but it is incredibly compelling, the degree to which majority of Americans are dealing with this level of precarity, and some of the populations, particularly families with children, that are so much higher in terms of that uncertainty and precarity than the general population. A couple of things that I think, just to add some texture and color, families that have a child with a disability or where someone is disabled face additional expenses that sometimes can't be captured by these large surveys. So I think it's important to think about that perspective. The role of place, so it's not just, you did the state-by-state breakouts, which are incredible. And I know I'm going to be using this data for a long time to come, so I just want to start by saying thank you. But even down to the zip code, the degree to which that architecture shapes families' opportunity and their ability to get to the job and find the transportation in addition to the cost of it. So those were a couple of things that I was thinking about that I think add additional texture and can be layered on top of this really important data set that is going to improve our understanding of the squeeze that families are feeling on both the income side and the expense side.
Wonderful, wonderful. And Tanya, we invited you here because you heard Ilham and Miranda mention this very, very directly, that yes, high costs play a major role, but so do resources, especially wages and the safety net. And you all do a lot of work on wages, and so I'd love to hear your reactions to the research as well.
Yeah, that was certainly one of the pieces that stood out to me in the report, as well as the fact that while it's not a surprise, the TCES data is not monolithic, that there are different experiences based on one's, inclusion of within a certain population. If I remember correctly, I think looking by race, white communities and individuals were at about 41%, while I think the highest was Hispanic or Latinx at 71%, with Asian and Black populations in between. There was differences in metro versus non-metro, differences in household composition that's been mentioned. So just if we think about achieving economic security for everyone, at JFF, we believe strongly that by providing resources and solutions for those that face the steepest climb, we will be more likely to achieve economic security for all. So it made me think about one of the main issues we work on, which is disrupting occupational segregation. And why is it that in certain fields, particularly low wage or low quality, there's an overrepresentation of certain populations, and the reverse is true in high quality, high wage jobs. So thinking about, again, the worker experience through the workforce systems, we also advocate for pay equity quite a bit. So just exposing and hopefully eliminating the rampant inequities that we see in pay based on one's population, gender, race, ability. We know that the same job or same resource doesn't always provide the same to the same individual. So really examining at a disaggregated level what some of that is. But I did also want to touch on the high cost part of the equation, and maybe less to do specifically with wages and jobs, but just in full transparency, I have a deep financial health background, so I think about both sides of the equation. And we also know that while resources are not experienced the same way for all populations, neither are costs. We know that certain populations face higher interest rates when they get loans. They face lower home ownership rates, which increases their cost of housing relative to their median income. We know that even appraisal rates, should they own a home, are often lower. So thinking about costs and resources monolithically is always a bit dangerous, and I appreciated y'all parsing that out in the research.
Wonderful, and it's a really important addition. And we talked about the differential costs of childcare, of housing, some of those other factors, but there's a whole other layer in the financial services when it comes to partaking in the financial services sector. Absolutely. So continuing, in this vein, I think many of us in the room would think of the TCES research as really a powerful tool for understanding, again, what it takes not just to survive, but to thrive in the United States. But as you've heard us discussing for the last couple of minutes, aggregate figures they only tell us part of the story. They can only tell us so much. And so I'm curious to hear from you all in your conversations with your members, with your constituents, with the communities and the populations you serve. What are you hearing directly from these individuals and these communities that you would add to this discussion? Why don't we go ahead and, Tanya, if you're okay, starting with you.
Yeah. So our center was born in 2020, which, as we all remember, was a pretty anomalistic time. And we started our population work really focused on Black learners and workers. We thought about Black learners and workers specifically because, as I mentioned earlier, we were focused on those that face the steepest climb to economic security. So while we focused on that as that population broadly, we also did specific deep dives into different segments of Black learners and workers. And I'm going to bring up some examples that were relevant to Black working mothers, which you might be familiar with some of this data. So the framework we use is when we think about quality jobs, we have several. And we came up with this list that we call the social determinants of work. Y'all are probably familiar with social determinants of health. And there's 8 or 9 factors, including broadband access, job flexibility, transportation, and childcare costs, which we've heard talked about a little bit already. And we found that for Black working mothers, their childcare costs represented about 56% of their median household income. And for white working mothers, it was half of that, so 26%. So large differential in the same cost factor that we're talking about. We found that for healthcare costs at employers with over 500 employees, Black workers were 10% less likely to have employer-sponsored healthcare. And that, again, going back to the occupational segregation conversation, has a lot to do with who's in what roles, what are part-time, full-time roles, salaried versus hourly roles, like who has access to those benefits that create high-quality jobs. So while we haven't done deep qualitative research, we have been able to get specific on the lived experiences of different populations that are sort of struggling within this system.
Yeah. Good segue, Melissa. To you.
Yeah, thank you, and thank you for that research. One of the things I was going to actually bring in is that we're talking about aggregate income, but there's a lot of income instability. So you have people who are hourly workers, people who are tipped workers, people who are seasonal workers, and families trying to budget within that level of income instability is another source of stress. So at the end of the year, you might say, I made this much, but month to month, whether that's in your SNAP benefits or whether that is in the number of hours you were able to get, it's not divided by 12. And I think that that's a really important insight, particularly if we're looking at it from a gender and race lens, because of the National Women's Law Center did an analysis of the 40 lowest paid jobs in the country, and 2/3 of them are held by women and disproportionately women of color. And going back to occupational segregation, a lot of these jobs are fundamental to our economy. Think about care work. That's the backbone of the economy. I can't go to work if I don't have care for the people who are in my life. And yet those women who are disproportionately women of color, immigrant women, are paid poverty wages. And so you go back again to this idea of childcare. It's not just about the cost, which is unaffordable, astronomical, completely unsustainable. It's also about the supply. Because even if you can afford childcare, it can be really hard to find. About half of people are living in a childcare desert where there's not enough licensed supply. Or even if someone is saying that they have care, it might not be the care that they are choosing. Or if someone is choosing not to work, or someone is not working, it might not be because they're choosing not to work. It might be because they can't find care. So all of these sort of micro decisions that are happening at the household level can't always be captured by the national data. And so what would it actually look like if we had high quality, affordable childcare for everyone with a care workforce that was paid living wages and respected? Well, then the set of choice architecture would be totally different. And so I think this is really important information to see where people are. But as we think about solutions and where to make targeted interventions, it's important to lift the hood up also and see what would transformative public investment actually mean for the set of choices people would make.
Absolutely. Powerful. Jimmy.
We love our data. We have a lot of data. But I think when you think only about data, and to answer this question, something that we feel like we've always tried to do is mash up data with actual conversations with people who have lived experience to understand what's actually going on. And something that I think doesn't show up very well in the data is in many of the conversations we have with families experiencing poverty, it's not just all sadness and grief, right? There's often a lot of joy. There's often a lot of pride. And people are sort of looking for situations to be able to spark more joy and more pride, even the simple joy of being able to provide for your family or to buy a gift for someone's birthday. These like very simple things that like may not show up in the macro factors end up being like real drivers of happiness for a lot of families. And so I think for us, it's kind of just always a reminder that like, yes, we have to like understand the macro trends, and the data is where a lot of the truth is, but that it's often not the full truth. And that like talking to people who are experiencing poverty and realizing that, yeah, it's like, yes, you know, housing's too expensive, food is too expensive, but that there are still these avenues for joy and pride in their lives, I think has been really meaningful for us.
Wonderful. And have you all been out in communities in the last couple of years? Because again, we're spending a lot of time talking about the trended nature of the data and the acute cost of living crisis. Anything that you've heard, again, from members in recent years about either on that joyful note, Jimmy, or on some of the other challenges that we've been discussing?
Yeah, I think the joy note has been like consistent throughout. So I started the company back in 2014, so we've gotten to talk to people as they've gone through a number of different cycles and the economy's, you know, changed. That part is not, and so that, you know, that gives me a lot of confidence that like actually what we're touching on is like something that's not a trend thing. It's just something that is the day-to-day reality of life for a lot of people. There are lots of trends though, and lots of things that do change over time. One of the factors that we're always really focused on as a technology company is usage of technology, starting from adoption of home broadband, smartphone adoption, but also going into like what are consumers expecting of software? You know, what are the things you can do on apps? What are the things that have websites versus don't? Do the websites work on phones or do they not? And those services have gotten increasingly better over recent years, but there's still a pretty big gap between what people get from the leading private software companies in terms of quality of software and what they're getting in terms of the usability of public services. And so I think, you know, for us, that's a lot of the gap that we try to fill, but I don't think it's not something that we will achieve by ourselves. It's very much a team game.
Wonderful.
And I mean, I think that there's, in talking to families directly, there's been both positive and negative things that they've shared. One challenging thing has been just navigating bureaucracy. And I think this is why the app that you've built is so important, and why we need more efforts from both a legal and policy standpoint, as well as from changing the culture of too often of shame or anything like that that accompanies usage of public benefits. But talking to families, they talk about sometimes the way they're treated when they go into an office, or they try to register for public benefits, or they'll talk about bureaucratic disentitlement. That's not the word they use, but all of the ways in which there's multiple barriers put up, the paperwork, the red tape, the extra office visit, all the information that needs to be collected that isn't really necessary. And so I think that there is, when we think about uptake rates and the ability of people to access the benefits that, in many cases, not in all cases, some of these programs are significantly underfunded and suffer from long wait lists, but where there is something like Medicaid or SNAP, where if you're eligible, you should be able to get it, addressing some of those administrative barriers is important. And from a positive standpoint, you know, a few years ago, I had a chance to work on an HBO documentary, The Life and Times of Katrina Gilbert, where she spoke about basically living on the brink. And the sort of focal point of the documentary was this 24-hour childcare center, because her hours were unpredictable. And another thing is schedules that we haven't talked about, but a lot of these you know, algorithmic scheduling and things that create all kinds of chaos in families' lives, and then having to shift your entire childcare around, the amount of stress that causes to a family. And having a really high quality place for her kids while she was navigating all that was transformative. And so I think that there are both sort of these lights that we look to and models that we can lift up, as well as these things that often exist beneath the surface, which in some ways are an implementation or in sort of the cultural or narrative barriers that we have to really fostering economic opportunity, because we're in a scarcity mindset, or because we're in it's only, you know, through individualism and bootstraps that people are going to lift themselves up. And those narrative barriers can be just as big sometimes as policy barriers.
Absolutely. Yeah. Yeah. I'm so glad we've already started to shift to solutions, right? We can spend a lot of time talking about challenges, but you all have started to hit upon solutions. So let's go there next. And, you know, I opened this event by talking about the fact that today's policy, regulatory, funding environment looks very different than it did a couple of months ago. And I think we collectively, right, are all figuring out largely in real time, right, how we continue our strategies or pivot our strategies to react to this current moment. And so I'd love to hear from you three how you all are thinking about advancing tangible solutions to enhance households' economic security, whether that's to bring down costs, elevate resources, strengthen the safety net, or any of the other issues that you all are working on. Would love to hear from you. We can take this in any order. Tanya, maybe we'll go to you.
Yeah, sure. So from our perspective, we think about and try to influence policy primarily on the resource side. One thing that we have, given the new administration, been really focused on that we feel strongly will and should have bipartisan support is further expanding and incentivizing work-based learning and apprenticeships. There are currently various federal subsidies, tax credits, et cetera, for employers to increase their work-based learning programs that allow youth, particularly targeted to opportunity youth, to both gain job-ready skills and college credits at the same time, so they don't have to make the decision between either earning wages, which they often need to support their families or themselves, and getting, you know, high-quality recognized credentials. I think in general, like the more we can provide policymakers with some of the data that we've been talking about today, the more resonant and relevant policy solutions will be. I had another one and it's escaped me, so I'm gonna let the other panelists go and see if I can have my memory jogged.
So I say this not to be facetious, but I think the first step is do no harm. You know, I don't know how you can look at this data and think that the best thing to do right now is to cut taxes for wealthy individuals and corporations to take Medicaid away from people. Like, I'm not sure how this tracks if you're looking at the data with that agenda. And so I think that if we're gonna lift up this research and really, again, hammer home, not just the research, but the lived experiences and stories of people who are struggling daily, over half of them in this country, to meet basic expenses without stress. And to really make sure that those voices are lifted up in our policy debates, so that at a minimum, we're not making things worse. When we think about opportunities to make things better, I see a lot of hope and progress in the states. There's been a lot of innovations that I think have given me some hope. Everything from, you know, ballot initiatives like in New Mexico, that they now have a constitutional amendment on early care and education that was people-powered and fueled and is now dramatically expanding both access to early childhood education and the pay for the early educators that are providing it. You look at, in Kentucky, there's been, I mean, so it's red states as well as blue states. There's been an effort to make sure that the people who are providing childcare can actually afford childcare for their own children. But there's been all these really interesting ways that states have been leveraging and implementing dollars that can be lifted up and thought about as we are creating momentum for federal policy change. And so that's where I see a lot of hope and momentum is coming up from the states.
So I didn't mean to leave a cliffhanger last time. There's $400 million of SNAP benefits being stolen. I said, I think there's an answer to it, and then I didn't say what the answer is. But the answer is actually like not rocket science. It's not actually that complicated. It is all about modernizing the EBT card so that it has some of the safety precautions and best practices that like every other card in your wallet has. That includes things like reissuing the EBT card as a chip card, but unfortunately that's expensive and pretty slow. It includes more education, so people who have SNAP benefits can understand how to avoid scams and fraud, but of course that's not a comprehensive solution. You know, we at Propel have a little bit to contribute here in that we're the only app in market that sends you a push notification when we notice that your benefits have been spent at a suspicious retailer. And that is something that is adding value to consumers right now. We've had it in market for about a year. And the next step for us is to figure out, can we take that same algorithm that's helping people to know when their benefits are being stolen and actually make it so that that blocks the transaction from happening in the first place. Very consistent with how, you know, if you have a private sector credit or debit product, and you have a suspicious transaction, you might get a text message that says, hey, did you mean to spend this, $3,000 in Russia at 2 a.m.? Like, was that you or not, kind of thing? That doesn't exist for the EBT card or for SNAP benefits, and that's the kind of thing where I don't think we need to necessarily reinvent the wheel. It's about applying the things that have already worked and figuring out how to give people who get SNAP benefits the same respect of those same kind of modern software programs. So that's something that we at Propel are working on, but we're not doing that alone. We're always looking for partners and help to get this rolled out. We think that it's a actually pretty time-sensitive matter because $400 million are going to be stolen in calendar year 2025 unless something like this happens. So always looking for any support from all sectors.
I'm heartened by the mix of solutions I've heard, from narrative change to the tactical of fixing EBT cards to having 24-hour daycare centers, right? I wanted to jump in on Melissa's point that about a lot of activities and actions happening at the state level. We've been tracking state activities when it comes specifically to addressing this cost of living crisis. We know it is very, very hard to bring down the costs of goods and services at the national level, but there are various actions that we've been, again, watching at that state level. Governor Hochul in New York proposed an inflation reduction, sending inflation reduction, inflation refund checks to residents of New York. Governor Green in Hawaii last year doubled the EITC and the food tax credit, also increased the child and dependent tax credit, various other tax interventions dedicated to prioritizing affordable housing for families in Hawaii. And then your point about it not just being blue states, right, but also red states and purple states. Governor Sanders in Arkansas proposed eliminating the state grocery tax. So states across the country are really exploring innovative ways to address this particular crisis. Tanya, did you want to add that last thought, or shall we move on to the next question?
I remembered it, but I feel like it is sort of a bigger picture, so we can wait until towards the end of the conversation. Thanks.
Perfect.
Thanks.
I have just a few more questions for these folks, and then we are going to pause or open it up to audience Q&A. So feel free to keep those questions coming. The next question I sprung on the panelists at the last minute, and so I want to really welcome those who would like to share thoughts to share them. But as I shared in my opening remarks, many of the challenges that we are discussing today are global in nature. And yet when we tend to have these conversations and sit in these rooms, we tend to focus exclusively on the United States. And so I'm curious, given how deep you all are in your particular issues, whether there are solutions or approaches that have worked abroad that you would encourage us to be thinking about to again be addressing the drivers of economic security. So, optional question for whoever would like to respond to it. It looks like Melissa's itching to go. Go for it.
No, I mean, paid leave.
Yeah.
is a big one.
Yeah.
We're the only industrialized country in the world without it. And there are tombs of research about it, both from other countries as well as in states here that have put in place paid leave, about it increasing maternal labor force participation, improving infant mental health, reducing the need to turn to other safety net programs. Take your pick. There's a positive outcome. It is associated with paid family and medical leave. And so I really think that is an important, it's not rocket science, it's not new, but it's something where there's tons of research and also broad-based political support across the spectrum. The other thing that's we have in other countries that we don't have here, we had here for a very short period of time, is a child allowance. Mm-hmm. Many countries have a child allowance that helps offset the high cost of raising children, in particular young children. And during the pandemic, we had in place for a short period of time a fully refundable child tax credit with periodic payments, a plus up for young children. Lo and behold, when you give people money, poverty and stress go down. We cut child poverty by nearly in half, and then it doubled when we took it away. Mm-hmm. And so I think that there are all kinds of sort of very specific and innovations or specific policy implementations, but I don't want to forget the broad sweeping research on what works. If you give people the child allowance, if you give people paid leave, if you have labor rights and strong union culture and organizing to build power for apprenticeships and for other kinds of things, those yield very positive outcomes for families and for the economy overall.
I want to piggyback off of that to add pensions versus 401k retirements, where the onus is really just carried on the back of an individual.
Yep.
And pensions that span spectrum of types of employment. So it's not sort of just the elite types of income earners that have access to that, as well as just public education, right? For learners in other countries, particularly in Western European countries, right? The cost of public education and the quality of public education is just leaps and bounds more accessible than it is here. And this is a room that I'm sure is very well aware of, like, the skyrocketing cost of public education. So I think these public goods that many other countries consider and integrate into their sort of political schema that we have either like moved away from or refused to do make a big difference.
And Tanya, I know Jobs for the Future has done a lot of work on apprenticeships, which are big abroad in Europe, Germany, elsewhere. Anything you would like to add about the apprenticeship work that you're doing here in the United States?
I will be honest that that's
Yeah.
a different center than I'm in, and I'm a recent addition to the Jobs for the Future team, but I encourage all of you to, I know that the team has done a lot of great work on what works particularly for youth, but also for adults within the workforce system. So
Perfect.
yeah.
And Urban Institute, I would be remiss if I didn't point out, that has also done significant amount of work on the role of apprenticeships. So more to come on that. Jimmy, what would you add?
Just a huge +1 on the cash assistance point, that we've tried it here in the United States. It's clearly worked. There are many countries outside the United States that are frankly farther ahead than we are on this front. We only operate in the United States, but we are our nutrition assistants and safety net nerds, and so we're sort of students of what's going on throughout the world. In Kenya, for example, the food safety net program is a relatively small program, but it's one that is doing cash assistance through smartphones, through the M-Pesa system. And so that's an example of the kind of new innovation that actually is like doesn't have to be that new, doesn't have to be that creative, but is creating a really big difference in people's lives. In Brazil, there are a number of kind of cash assistance programs that are helping to fight food insecurity. And so I think there are real opportunities to think about, if you can introduce certain types of flexibility into food programs while continuing to keep fraud rates low, does that actually make the programs a lot more effective and allow taxpayer dollars to actually stretch further?
Wonderful. I want to turn to audience questions now because we've received several good ones. I'm going to hold on to a couple questions to close the panel with. The first question is easy. There have been some questions about whether the event is being recorded. I will reiterate that the event is indeed being recorded. The recording will be posted after the event. Moving on, Jimmy, we have a question for you about whether you could speak to how states are responding to SNAP theft. Are individuals' experiences taken seriously? How are their benefits returned to them if they are?
Yeah, I mean, everything we've seen has shown us that states are taking it incredibly seriously. I think states are attuned to the amount of pain that's being created by this trend, and they're doing what they can, but unfortunately, in many cases, their hands are tied. The amount of budget needed to reissue chip cards, the amount of budget needed to reimburse the volume of stolen SNAP benefits is often just beyond the scale of what an individual state can be able to make room for. Now, there is a range. We are huge fans of what's going on in California and in Maryland, where there are actually states that are finding ways to reimburse stolen SNAP benefits, and so there certainly is a range. But I think states, a pretty consistent theme that we are hearing from states is we would like to have more options. We really want to fight this, and we just don't have the right tools. And so I think in the SNAP world, there's a combination of the things that are available to states and what USDA at the federal level is kind of green lighting, and so there has to be a kind of close partnership for those to make it happen. But I certainly don't think it's a matter of states aren't aware or don't care. I think it's a question of how do we move into solutioning and get something that is deployed quickly to people.
Jimmy, we're gonna keep you in the hot seat. This question will start with you, and if the others want to jump in. With access to increasingly nuanced tools to assess need on an individual or family basis accurately, how do we reduce red tape or procedural delays in accessing public benefits?
you know, I think of like this umbrella term of red tape is, as you know, for people who are kind of working in the space, we all know that that's not just like one thing. There are many different things that can contribute to a delay or something that is making a program harder to access for a consumer. You know, we are focused on the software side, which is just like, is the website easy to use? Can you use the mobile app? Does it actually load quickly, tell you what you need, help you to get the thing you're asking for? That's kind of one corner of it. In the SNAP world, there have been a lot of challenges in post-pandemic times on staffing. So because there are still a lot of human-powered processes at the state and county level to process new enrollments in SNAP benefits, when there's a shortage in staffing, you know, a lot of people that are applying for SNAP may not get the answer that they're looking for as quickly as they're looking for it. And so what's the solution to that? Well, I think it's like realizing the economic cost and downstream cost of not properly funding those teams and those key roles. But I think it's a complicated question. It's not one that we aim to solve by ourselves, this idea of bureaucracy or red tape, but I think it's a really important one because I think sometimes it gets lost. I mean, of course we care about the macro trends. Of course we care about Medicaid cuts at the federal level or SNAP cuts, but I think something that often gets lost is that even when we have great programs, that there's still the last mile challenge of how do we get those benefits to people, and the usability of those services for many people just looks like, is the website up? Is somebody answering the phone if I call? Can I get the answer I'm looking for? So it's kind of less of an ideological thing and much more of a practical one.
And can I just make a complimentary point to that, which is I agree 100% that those last mile pieces are really important. And I think a lot of people don't always see the federal state feedback loop in terms of funding. So for example, if you cut Medicaid, it's essentially a big cost shift to the states. That's what it is. It's here's states, here's a giant bill for a bunch of people who are uninsured, a bunch of services that were previously reimbursed with a higher federal rate. And then it's left to states to solve those problems. Well, they have to either, because states have to balance their budgets, they either have to raise taxes or cut other services. And so when people are talking about Medicaid, they're often just talking about healthcare coverage, which is, losing healthcare coverage is bad enough. But then you go downstream and you see that the Medicaid dollars are weaving their way into services with children with disabilities. They're weaving their way into the bus that someone takes. They're weaving their way into the home health care aide that's taking care of your grandparents. They're weaving their way into whether or not state workers are able to stay employed because the money that was previously funding them now has been cut because they have to fill a hole elsewhere. And so it can be really hard, I think, to sort of see the life and times of a federal Medicaid dollar weaving itself through the system. But it's incredibly important when we think about these big cuts to think about the federal state feedback loop and the way they actually play out in people's lives on the ground.
Absolutely. I'm so glad you said that, Melissa. We had a similar conversation this morning in a strategy meeting. And I want to put a pin in that because I'm going to ask you, as one of the wrap-up questions for this panel, about new data and research that Urban Institute and other researchers, our partners and others, could produce. And that feels like one to really assess some of those spillover effects, those unintended consequences to follow that. To follow
the memoir
that
of the Medicaid dollar. Yes.
And we even have a title for it. Wonderful, wonderful. I have a couple other questions that I think are fantastic, so I'm going to toss these out to the panel. One of our attendees is curious about the role of the underground economy, for example, off-the-book work, and the role that plays in people's financial lives or local economies. It's an open-ended question for whoever would like it.
I think there's no denying that it exists in many, many communities who don't have access to formal resources, whether they be public or private sector or earned, truly rely on either their own community or social circles or any kind of hustle that will get them those last few dollars. I think it's a real shame that we have so many individuals in that position because we all know that those dollars, while they fill a really critical need, don't come with any support. They don't come with any guarantees. They don't come with any insurance. They don't come with any of the protections that many other resources and income comes with. So I think at this point, it's like it's understood, it's acknowledged, it's shameful, and it's not at the same level of other resources that we've been talking about all day.
And I would say that oftentimes the care economy is part of that,
Yeah.
because you think about the, family, friend, neighbor care, the neighbor next door who watches your kids after school, who you pay a little bit of money to so that you can get home from work a little bit later, or the grandmother who gives up her own earned income to care for her grandchildren so that her daughter can make it to work on time. Whatever it is, these kinds of arrangements, again, are the backbone of our entire economy, and we don't value that work. And I think it's an indictment overall of, again, this occupational segregation, this idea that care is not real work, when we know that, yes, it's love. Yes, it is done with love and joy, and also it's work. And I think that if we were to acknowledge that and really value care and the role that it plays in our economy, it would take us a long ways away to eradicating some of the gender and racial gaps in occupational segregation.
Well, and Melissa, to that point, I think the question, maybe this was underneath the question, but not all of the underground economy is financial, right? A lot of those in-kind, as the formal term is, actions, behaviors, favors that people do for each other that we don't, in this capitalistic system that we're in, like, don't value financially, really are what carry people cross the bridge.
And create a lot of that joy and connection
Yeah,
that Jenny
right,
was talking
right,
about. Because,
right.
that people being in community with one another is a big part of the joy, regardless of your socioeconomic status.
Yeah. And those activities are never going to show up in this quantitative research that we did, and that's okay. But as we look at those gaps, and Ilham explain some of the ways that people may be covering those gaps, one of them, though, I'm sure, are these informal activities. Staying with wages for a second, one of our attendees is curious whether the panelists have opinions on the potential benefits and costs of the policy proposal on no tax on tips and overtime.
So,
Melissa has an opinion, please.
this is something that they are not for, and I think it's easy to see why. It's easy for people to think like, oh, this is going to help me, but in reality, number one, you're not actually. A lot of the corporations that are paying are just recapturing it in different ways. It's not actually providing real tax relief to the workers themselves, and number two, it's taking away some of the, again, long-term payment into Social Security, into other kinds of benefits that people are going to need long-term. So it's robbing them of long-term economic security. A much better policy would be to increase wages across the board, and make sure that people actually can get the benefits that they need, and have that stability.
Would you say also tax credits in the form of, if the idea is to give certain individuals more resources, targeted tax credits versus?
Yes, exactly.
Okay.
Yeah, agreed.
Okay. Great. A few more questions. These questions are great, so thank you to the audience members. Let's see, staying with wages and income. One of our attendees is curious, beyond policy changes, do the speakers have thoughts on what can be done at the regional level to create the conditions to, for example, incentivize employers to pay living wages, or create conditions where the region is focused on the growth of jobs that pay living wages, or other levers? So questions about how do you create conditions for living wages at a regional level?
So JFF does have a Center of Workforce and Regional Economies, and we've been partnering with them lately on regional specific work. Given sort of the new environment that we're in, we're thinking about how we circumnavigate some of the newer obstacles that have been presented to us. And what we are proposing to work on, so this is sort of a preview rather than me having any data to share, is to take a regional market scan using, for that particular region, what are the high demand, high growth careers that we know people can thrive from, and what are the associated resources, training resources, educational supports in that region, and what are the gaps? And then bringing together both the providers, solutions, innovators, employers, workforce boards, et cetera, to think collaboratively and creatively on how to bridge those gaps, showing employers ultimately do want high-skilled workforces, and being able to work in a sort of collective impact kind of way at a regional level feels a little bit more accessible and doable than at the national level right now. So that's an upcoming piece of work that we hope can maybe next time answer that question specifically.
It's exciting.
You know, something that we're continuing to be excited about and think there's opportunity at the regional level is the work opportunity tax credit, which I think maybe gets swept under the rug a little bit. But the work opportunity tax credit is providing an incentive for employers in many cases that are hiring somebody who is previously using a safety net program. And is the kind of thing that we're actually, like, as I understand kind of the kind of political narrative around that tax credit, it was, hey, we could actually save taxpayer money in the long term if we're incentivizing employers to hire people that were previously receiving government benefits, often on the order of thousands or tens of thousands of dollars per employee hired. It's the kind of like thing that I think can practically make a huge amount of difference. You know, the implementation is pretty challenging at the state and regional level, and so there are some issues that are preventing it from, I believe, getting to its full potential and its full impact. But I think that's an example of an area where there is a policy lever to actually help with employment in this population.
Great, I'm good. Okay. So I want to conclude with two questions. I said I was saving a few of mine for, I want to close the panel on these notes. Right after this, we will go to a break, so I realize we are all that stands between you all and your break. But we are at the Urban Institute today, and so I would love to spend a few minutes talking about data research and insights that you all think would be better to helping change makers, decision makers, policymakers, community leaders, right, better understand the evolving nature of households' economic security, and then secondly, to assess the effectiveness of policies, practices, and solutions designed to improve households' economic security. In any order you would like.
Well, besides the memoir of the Medicaid dollar, I think there's some really interesting work by Bradley Hardy on income instability. And I think in general, looking more at in how we measure income and in how we're tracking income, the degree of variability that families are facing, whether it's because of schedules or because of seasonal work or because of just low paid work oftentimes is not super stable. But I think that is really important on the resource side of things that is often underappreciated. It's not just the amount of income, but the stability of the income. And I think it also helps push back on this narrative that poverty is this fixed state, that you are poor. When in reality, most people at some point in their lives, 4 out of 5 Americans, research by Mark Rank and his colleagues show, are going to experience poverty, near poverty, unemployment, turning to the safety net at some point during their working years. And so if 4 in 5 Americans at some point are going to dip into that, then it becomes more of an us story and less of a them story. And so I think a better and deeper understanding of income instability, and then how our safety net is able to be responsive to that, how our care systems are able to be responsive to that, how that affects children's development and the resources and supports that they need, would be a really important and interesting area for further research.
I think for us, it is trying to identify things that are in the challenging intersection of the Venn diagram of is really good for families and saves money. In this particular moment, it seems like those are the kind of messages that seem most resonant. And so it's where we've been focusing some of our time and attention, but I think there's a lot of kind of research opportunity for, let's like take a narrower lens and can we get practical about like what are the things that we can find in that intersection right now.
It's interesting to talk about data in a time where data feels like it's losing some currency at the political level and decisions are being made without it. I think that should be no reason for and I don't think anyone in this room or listening at home will abandon data. And so really thinking about how we present and talk about it in a way that is compelling and inclusive. We've begun at JFF talking about the economic benefits of a fully employed workforce. That means everybody that wants to engage in the workforce has access to an opportunity to engage in it. That allows us to then identify the populations that aren't currently fully engaged in the workforce. And so we're working on, and would love to partner with anyone who's interested in working on mapping journeys, like I mentioned at the beginning of the panel here, that two individuals, let's say with the same degree in the same town, do not have access to the same opportunities. Should they have the same job, should they get the same job, they don't always have the same salaries starting or ending, right? Just there's these differences within journeys that we able to like visually represent or talk about in specific detail to show where we have opportunity to pull more people into the workforce, which ultimately benefits everyone. In that regional example that I gave, I think you'd be hard pressed to find any sort of governor or regional public official that wouldn't want economic stimulants in their economy, and that will come from a more participatory labor force. So I think really understanding the specific experiences of different populations, and the more granular we can get with that, I think the more powerful our solutions and the more powerful our argument that, you know, it takes all of us, right? It's the sum of us, as Thermagi said.
And I just to build on that, I think that, you know, as I said earlier, nobody would look at the data in this report and say, you know what we need right now? We need to cut SNAP. We need to cut Medicaid, and corporations and wealthy individuals, they need more tax cuts. Like, that is not what the data leads us to in terms of policy. So I think that it's, to your point, it's also about how are we, like, it's not just the data itself, but how are we using the data to build power? How are we using the data and making sure it's getting to community stakeholders who are constituents? How are we using the data and pairing it with personal stories that are compelling? And so it's both more and better data, but it's also, I think, we have to, in these times, get really creative and disciplined about how we're using data.
And the storytelling.
And the storytelling that goes with it, right?
The storytelling and then the granularity. We at Urban have had a lot of conversations about producing meaningful insights at the level of congressional districts. If we think that's going to move the needle with slim margins in Congress, you know, 1 or 2 votes in either way, based on the evidence, right, could sway policies. The granularity we've been talking about, the rapid response nature, and then some of those spillover effects, Melissa, that you were mentioning. There's, you know, things are happening at such a rapid pace that to have rigorous research to inform, right, if it reaches a handful of the right people, could indeed, you know, have an effect, have an impact. Anything to add? No? Great. Okay. Last question, and then I promise we will get you all to the break. So we spent a lot of time talking about challenges, but, you know, in preparing for this conversation, we had some conversations about reasons to be optimistic in the current moment. And so I'd love to end on this note of optimism as you think about the future of households' financial security, about the progress we've made, about how we can sustain that progress. What, if anything, and you don't have to be optimistic, right? But if you are, what, if anything, makes you optimistic about the current moment?
So I think that one of the findings of this report, whether it explicitly says this or not, is that poverty is a political choice. That, you know, we have tools, we have tax credits, we have SNAP, we have tools to increase wages, we have policies that invest in young children and their economic opportunity. We have evidence that these things work, which means that we can make different and better choices. And so I sort of remain hopeful that the research paired with political power, paired with stories and narrative, that we can get to a place where what we know to be true is actually, and what we know the vast majority of the public supports across the ideological spectrum can come to a place where it's transformative in our politics. So I think that for me, the hard part of the report is how many people are suffering. But I think the bright spot is that it's very clear that it's a choice, and different and better choices can lead to better outcomes. And that, I think, is empowering and gives people the hope and the tools they need to pursue a different future.
For me, optimism, it comes in part by just knowing that there are certain things that actually are working. That like if you look at the number of dollars that Americans pay in bank overdraft fees, that's down 50% compared to pre-pandemic levels. In my domain, Americans can now spend their SNAP benefits online. That was a thing that was in the works for many, many years, but didn't roll out until the middle of the pandemic. And so there are things like this in which like the safety net and the daily lives of low-income Americans and people that have financial needs, they have changed. It's not all good, but there are some things that actually have improved over the last few years, and I think we shouldn't lose sight of that. But I mean, broadly speaking, my reason for optimism is just belief that the work in financial security that is done by everyone in this room and people on Zoom is going to get more important and not less important over these next few years. And so the engagement and the enthusiasm and the optimism of this group is like that's the sustainable energy source to continue to make those wins and continue to go drive these things forward.
It's a tricky question, and my answer often depends on the day in terms of being pessimistic or optimistic. I think maybe I fall into the like realistic optimist, mostly for my own sanity. I think that, sorry, forget where I was going with that. I think that what brings me optimism is being in rooms and remembering that there is a large community nationally, regionally, locally that is committed to data, that is committed to increasing opportunity and economic security for a lot of people. And right now in this moment, which this country has seen worse, certainly, but it is, pretty dire for a lot of us, that we are who we have right now and we are who we count on and keeping our heads down and really doing what we need to do to adjust, even if it might feel sort of internally, there's that ick factor, right? Like having to acquiesce to certain things in order to stay present and relevant. So understanding sort of the flexibility that we all need to adapt right now is important. And I do think fundamentally this idea of like the power of us or the sum of us, that like all of us participating equally, all of us being valued is a lifeline for me. I think that this narrative and storytelling around, the economy of a non-degreed individual with relatively low skills having long-term employment that is family sustaining, that's not the world we live in anymore. And I think that people on both sides might be, hopefully quicker than slower, like coming to that realization that we have to move. There are data supported trends that we have to follow in terms of automation and talent development. And I think by using our data in creative and compelling ways, like really meeting this moment in a way that, whatever language we're allowed to use, like is inclusive and comprises all of us, like that to me feels hopeful.
Wonderful.
Yeah. I was going to say, Fatima Gasgraves, who's president and CEO of the Law Center, National Women's Law Center, has said that hope doesn't fall from the sky. It's rooted in community and a plan.
Yeah.
And so I think sort of I'm like, let's go get our people and let's go make a plan.
Yeah.
And I think that there's always hope in people power.
Well said.
Well said, indeed. On that note, in just a moment, I'm going to ask you to thank our panelists. But I do want to announce we are preparing for our break. We have about 15 minutes or so. So please take a bio break. Help yourself to, I believe there are some refreshments out there. Maybe that's coming later. Water and coffee, exactly. Help yourself to water and coffee. Stretch your legs, and we'll come back for our final panel discussion, which will be preceded by remarks from the Urban Institute's president. You do not want to miss her speak. So please be back in about 15 minutes. Please join me in thanking our fantastic panelists. Okay.
Good Good afternoon, everyone. Thank you, online audience, for sticking with us. Really appreciate everyone being here. I am probably over-advertised, but I will do my best to be a uplifting but strategic transition to our next part of this conversation. I have the great honor and privilege of being the president of the Urban Institute and to get to say just once again, thank you all for being here. I want to thank you for being here with us because there is a lot of competition for our attention for all kinds of things. I mean, reading our phones of what's changing and at what pace, it takes a lot. And you all chose to be part of this conversation in person and online, and we appreciate that, and I would argue it is actually the most important conversation if we are to understand some of what's going on in our country. Let me quickly just also say thank you to our speakers and our panelists, people who took their time to travel and be with us today and share their works and their insights. I want to thank our funders, PNC Bank and JP Morgan Chase, for their generous support not only of this event, but of the research and insights that inform it. I want to say thank you to my colleagues who planned this event. I am every day proud as punch of the extraordinary folks at the Urban Institute. Today, this was brought to you by Thea Guerin, who you've just seen, and Maria Santillo on the financial well-being team, by Catherine Harvey, Katie Napotnick, and Keith Fudge on the upward mobility team. We have lots of teams at Urban. By Ilham Dehri on the true cost of economic security team, and Nico Madrigal and Haley Romer on our spectacular events team. But this conversation is important and timely, even at this moment, I would argue, especially at this moment, because time and time again, people report that it was and is economic issues, whether it's the ongoing effects of inflation to the affordability of housing, healthcare, and education. These are what they say are their most pressing concerns. And personally, I believe that it was the ongoing financial challenges that everyday Americans face. It is the lack of the ability to feel like you can get ahead and create a better future for yourselves and your families. That is part of what is driving the profound distrust that so many Americans have with so many institutions, whether it's universities or government or private companies, and that then distrust we're seeing play out in our headlines. So today's discussion puts the focus back where it belongs, on the people who are struggling to provide for their families amid high living costs, and on the community leaders, the service providers, the data analysts, and the innovators who are working tirelessly to use the tools at their disposal to improve people's lives. We know that criticizing is easier than solution. And we know that addressing the complex challenges are going to require collaboration and innovation. We're not going back to find the solutions that haven't worked in the past. We've got to keep looking forward for the next idea that's going to help us to make change for people's lives. We know that meaningful change will only happen if we address root causes of these challenges and improve the systems that create the conditions that enable everyone to thrive. All of the speakers on today's program focused on or represent organizations that are embracing what I would call a holistic approach. They represent collaboration in action. And in that spirit of collaboration, we hope that the insights and expertise that is shared by our great guests today inform how not only the people in the room can move forward, but also how those of you online and others can move forward to make change. At Urban, we've always believed that in times of change, it's more important than ever that leaders at every level of government and in every sector of our society have reliable evidence to inform their decision-making. For more than 50 years, we've helped change makers design, advance, test, and share solutions to improve people's lives and strengthen communities. And that's what we need to do even more now as a community. We need to look at what we know and what we can try and keep really pushing on creative solutions that maybe we didn't think was possible before, but amidst sort of a ongoing challenge to so many of the ways that we've addressed these problems before, maybe there's an opportunity for creativity and innovation. So we look forward to continuing this work with our partners, our funders, and other change makers, whether they're in the states and localities around the country, or I think we will find places of common ground, perhaps here in Washington, too. I encourage you to continue to be part of our community of ideas, to support local leaders and organizations that are directly working to enhance households' financial well-being and creating opportunities for upward mobility. Show up and engage in conversations like these. Look for practical evidence-based solutions. And most of all, as I heard on the last panel, I think the expression was hope with a plan from my friend Melissa. So thank you all. I would now have the pleasure of introducing Catherine Harvey, who will moderate the next panel and, importantly, introduce the great speakers that we have. Thanks for being with us.
Good afternoon. As our panel is getting settled, I just want to thank Sarah and thank you all again for joining us this afternoon, wherever you are, online, in person. It's wonderful to be here in a time of great change and to follow a panel that's really grounded in evidence and groundbreaking research. My name is Catherine Harvey. I am a proud member of Urban's Research to Action Lab. So welcome to the Action panel. We are going to be talking solutions. And every single one of the members of this group is from a local community that's worked with the Urban Institute. They have leveraged data tools, resources, and technical assistance to advance upward mobility in their communities. So not just helping people meet basic needs, but also be upwardly mobile. And we're really proud of that work, and we've learned so much from all of you. I'm excited to hear from each of you. You may be asking yourself, how can we talk about solutions amidst all of these very present threats to our institutions, to those policies that undergird so much of the progress we've made on behalf of communities? I've been asking that same question in my hometown of Omaha, Nebraska, and community leaders tell me the same thing consistently, and I've heard from our panelists as well, and that is that the work continues and we will adapt. Right? And so those are the themes that I think really I've carried with me. That is my source of hope. But it's not coming from a place of naivete, right? So this is a conversation in the thick of it. And we're going to be hearing from this group about how they're navigating it, what are the headwinds, and how they're thinking about sustainability of their momentum. So I'm going to introduce the panelists. Their bios are in your packets and online. All of them wear many hats, so I'm going to choose one of them as I go down the line here, and then we'll get into the conversation. And we will have audience Q&A for this session as well, followed by a reception, so please stick around for those in person. Melissa Robinson was elected in 2019 to lead to the City Council of Kansas City, Missouri, and represents the 3rd District. Welcome, Melissa. Thank you for being here in person. Jackie Carrera serves as president and CEO of the Santa Barbara Foundation in Central California. And Frank Cardella is Director of Economic Mobility for the United Way of Greater Richmond and Petersburg, close by here in Virginia. Welcome to our panelists, and thank you for being here. I want to start where the last panel sort of left off. Here at Urban, we've got a pretty broad definition of economic mobility, and it gets to that point Jimmy was making about joy. We define economic mobility more broadly than economic success. We also include power and autonomy, dignity and belonging. And we have a framework developed in consultation with community leaders across the country called the Upward Mobility Framework that we use to undergird this work. And so as each of you sort of align to that North Star of upward mobility, I'm very curious to hear what you see as signs of momentum. Thinking over the last year, what has been success for you, something that you've gotten started, some trouble you've gotten into that's good trouble that you want to share with the audience around economic mobility. I'll start with you, Melissa.
Sure. So in being an elected official, one of the things that, and I've served on the school board actually 5 years before being on the city council. And so what that means is I've just had a lot of opportunities to work in the policy realm of things. And when you start out your term, any term, you start with anchor legislation, things that for us it's a 4-year term. And so what do you want to get accomplished in that 4 years? And so I started out with racism as a public health crisis, listed out all of the data around why this is important. We have a 13-member council. It passed 13-0. I was excited. 2019, let's go. And then we moved to a very early in our term where we start talking about tax breaks for developers. And a lot of times in cities, we measure our success based off of the number of cranes we have in the air, based off of those physical things that are being erected. And we started talking about TIFs, tax increment finance. And I thought, well, you know, we all passed this economic mobility framework when we talked about racism as a public health crisis, where all the data was rooted in people's access to economic well-being, much of which is education. But we're taking those tax dollars away from our educational system that's then going to lead us into this crisis as it relates to public health outcomes. And so there was a lot of deflation or being deflated in that space, because it's like, you know, you present the data and everybody's on board, but then at that very first vote, it becomes challenging. And that's why it's so important to lean into leadership, because it's not just about having that elected official who aligns with your values and someone who can introduce an idea and champion an idea. It's really about how do you change the culture of an organization so we're not valuing cranes over those really foundational elements of economic mobility, which is one, education. So through that, I was able to recently, with the help of the Urban Institute and being a part of the Mobility Action Learning Network here at Urban, I was able to get my colleagues to 13-0 vote to invest in an economic mobility strategy. And now we have $500,000 for the city of Kansas City that's really focused on economic development, that's focused on people, moving people from $14,000 a year to $60,000 a year. And our earliest panel, I know we're on the right track because those very fine, educated, eloquently speaking folks that talked about data, they talked about the importance of going granular. And this resolution that we passed that ensures that the city is the first investor in economic mobility, it's about 2 zip codes that are experiencing high levels of poverty. And not only experiencing high levels of poverty, but they're living in high-level poverty neighborhoods. And so looking at how do we as a city, again, first invest, but not only that, how do we connect with an external provider in which they wake up every day and their focus is on how do we move this group of people with this very big, daunting task? How long is it going to take? But it's important for cities to reframe economic development in terms of people and how we're investing in people. So that's been my big, momentum moment. And
Absolutely.
I'm really, really appreciative to Urban for helping to make that happen. We just passed the budget last week, and so it's final.
All right. We don't get a lot of unanimous votes here in Washington, so we're salivating,
Right.
and we'll dig into the journey to get there, because I know it wasn't easy either at the local level. Frank, would love to turn to you next. You've been in the game here in the region of Richmond for a while. What do you see as signs of progress, and what is your economic mobility initiative locally?
Sure. A couple of things. One, we got a website.
Woohoo!
Yeah, no, that's important, right? It's RVA Rise. We have a name too, rvarising.net. Right, poverty, homelessness. It's going to be top-level domain. That's the stumper today. But we have this identity, and that's really important. And so it's what's in a name, right? RVA Rising. We have a website. But if people can't find you, if people don't know what you're doing, then they can't get excited about belonging. They can't get excited about being part of it. So having this opportunity to name something, give it power, breathe life into it, and attract other people to it is really a critical piece of building momentum. And that's important because I've seen over the last 25 years that I've been in Richmond, a lot of initiatives that start out and then they flame out after a short period of time. So having that kind of hope, again, we've heard hope a lot of times today, having that hope that you can continue to sustain the work and move it forward by attracting people to it is really important. The second piece of that is buy-in, and that is critical. We have been having conversations in various tables around the region for a long time, and then we found this little thing, maybe you've heard of it, the UMF, right? And so we got this
You want to spell that out for
upward mobility
those not in the
framework.
room?
We had the upward mobility framework to kind of coalesce around. And by bringing in things that we could all agree on and providing many on-roads into the work through government coalitions, nonprofits, philanthropy, local citizens, we had a project called the Virginia Community Engagement Index telling us what people around the area were interested in and what they wanted from services, how they wanted to engage in service. So we were able to bring that in. And having those many on-roads in really allows people to buy in at the level that they're able to sustain.
Thank you. And we do have the website on the chat for those online. It's so new, it's squeaky clean. But we'll come back to RVA Rising as an entity because as you alluded to, Frank, it's more than one organization, and I think that's going to be a key theme here today around collective action and collaboration. Jackie, please let us in on the latest from the West Coast about what is going on in your community around upward mobility and what you see as a bright spot.
Okay. Well, this is an easy one, but let me start by saying thank you so much for having me. I've been so excited about this panel for the last couple of weeks. I haven't really had time to think about it for the last couple of weeks, but every time I did, I was like, this is so fantastic that it's happening. And then I sat in the audience today and I was like, I'm really glad I'm here. This is amazing. Every word that was said, it just resonated. And part of the reason for that, actually, let me start here. How many people have been to Santa Barbara? Okay, isn't it beautiful? How many people really want to go to Santa Barbara but haven't been there yet? Isn't it nice? Yeah.
The rest.
But the dirty little secret is that we have 70,000 people in poverty and of a community that's 440,000 people. We had some data come out from our Public Policy Institute of California a few years ago that said that we are the second, our county has the second highest poverty rate out of the 58 counties in California. We say that statistic to people in our community that have lived there for decades, and they had no idea. They really almost don't even want to hear it because it's shameful. And so for the last couple of years, I work with the Santa Barbara Foundation, and our organization has been working on a variety of issues, but they were all rooted in data, and they were all rooted in this love of our place and our community. And I would say that, I know you haven't asked about optimism, but you did say what was the little bright spot in this last year, and that is that we're in a place where people really do care. And there's a lot of potential to make change. It's 440,000 people. We can do this. And so for the last few years, our organization has been working on issues like childcare. We have one slot available for every 10 kids from 0 to 5. That's an issue. It's an issue everywhere, but it shouldn't be the case. So we've been working on that and making great strides there. We've been Struggling with housing, I'm sure you know that, which is huge. We have 55% of our population paying over 50%, over 30%, so they're rent burdened. And then we have another 29% paying over 50% of their income on housing. Again, shouldn't be the case in Santa Barbara County or anywhere. Digital equity. We have about 8% of our community that isn't able to connect. And so we have initiatives around each one of these things. And I don't just say we have programs and initiatives, we're making significant strides in our community around these really important issue areas, which in and of themselves can be dealt with. But when you start to look at something like the urban mobility framework and you see the predictors that are all feeding into these pillars that are so key for our community to thrive, you know, we feel good that we're on the right track. We're working on the right issues. But yet, at the beginning of all of this 2-year journey that we've been on, we really didn't know what this was going to add up to. And a couple of things happened, but the biggest and I think, like you named some things that are key. I think having champions around certain things are really critical at the community level. And we had a community champion who was committed to poverty. She saw the statistics. She works for a community action coalition called Communify in our community, and she just grasped onto this and did not let go, Julie Weiner. So shout out to Julie, because she was running around the community saying, well, you're doing some great work here and you're doing some great work there, but what if we did this? What if we all came together? That was just what we needed at that time, between the nonprofit organizations, healthcare institutions, educational institutions, our government. We were, again, all doing great work, but in these silos. And so we came together really at first to talk about poverty and the poverty rate and that data, and started to think about a summit, a conference, something that would bring everyone together. And that was hard to create an agenda when the issue was so broad, you know, poverty, and we weren't the Urban Institute, having done all this research for these last few years, and started to identify what some of those key factors were. So it was really fortuitous for us to find the Urban Institute and have and become part of the work here to understand that there has been all this data that's been collected and these theories that have been tested, and that this framework has been set in place because it helped us frame what we were trying to do in our community. So we ended up, all of this thinking and working and developing a framework ended up culminating in a conference that took place, or summit, on January 24th of this past year, with 2 different sites, North and South County. So we're about an hour and a half apart from each other, if you're going the speed limit. And we had 2 community colleges host the virtual events. We had Matthew Desmond speak. He's the author of Evicted and Poverty by America, virtually. And then we had panels with some really fabulous speakers, frameworks. Alexis Weaver came and laid out the urban mobility framework. And then we had some really great speakers from lots of different places throughout California and locally. And then call to action was to break into these 5 work groups. And we now have over 100 people who have signed up for one of the work groups, and the work groups are mirroring the framework. Mm-hmm. So I'll stop there because there's so much more.
I think what you're hearing here is there's been a journey, and we're in the midst of it for each of your communities. And for those of you not familiar with Urban's upward mobility work and the upward mobility framework, I encourage you to check it out. We've got a data dashboard that's interactive down to the zip code level in some cases, and it's a comprehensive set of predictors of the conditions that are essential to encouraging upward mobility for residents. I think in addition to our collaboration together, I am very interested in the collaboration at the local level. And Frank, you alluded to past efforts that have stopped and started, and I think anyone who's worked in community is familiar with that. And even here inside the Beltway, at a national level, you get funded to do something, you come together, and that sort of dissipates when the resources are gone. Can you talk a little bit about those past efforts? What made this time different?
Yeah, so first of all, my colleagues are a little bit ahead of me in terms of getting event-level things done, and I think there's a real understanding of place. One of the things we've heard a couple of times on different panels tonight is how important that place-based knowledge is. And let me tell you a little bit about the Richmond region. Virginia is the only state in the United States where cities are independent from counties. There are 3 other independent cities in the US, Baltimore, St. Louis, and Carson City. Every city in Virginia does not exist within a corresponding county government. And so everything that needs to be done, therefore, requires additional negotiation because the economic engines, the transportation grids, all of the collaboration that has to happen now gets multiplied by multiple people with a stake in that and a stake in the governance of it. So our region, the MSA has about 1.2 million people in our region. Richmond is about 250 maybe. The 2 very large suburban counties that Henrico to the north and east and Chesterfield to the south and west are in the 330 to 360 range. And then we've got, depending on how you define the region, you might have 8 other very rural counties that ring the next layer outside of that. And so trying to find solutions that work for high density, medium density, low density, all within interlocking transportation grids, all within different planning districts, right? It's a big challenge. And that's largely what has plagued the region for many years, trying to get all of those players together at the same tables to talk about substantive issues is really a challenge. And so that was one of the things that when we had a number of these conversations happening between players in the different parts of the region, and we brought in the framework and said, hey, let's talk about poverty in a different way. Let's talk about this 3-part definition for upward mobility from poverty, and then let's talk about this structure of these different pillars in which the siloed work was already happening, but recognizing that there were nexus points between those silos, that we could bring people together around that, has really been a game changer. And that has been, I think, the single biggest difference that I've seen in this iteration is that people are willing to meet each other in a place where it's not being led through a singular lens. It's not someone's project. It's all of our project. It's a collaborative project. And I think that's really key to getting any of these next steps to happen. So whether it's bringing in speakers, that was happening, but it was only for this group. Or looking at data, well, that data was localized and it wasn't being shared regionally. So having these kinds of tables where we've got everybody in the room. And also the other really important thing is that it's not being led specifically through a government entity. Because there are so many different local governments that all have to buy in, there's not a single point of focus through a government agency. It's being led by United Way and Community Foundation. It's being led by the Health Foundation. It's being led by the Chamber of Commerce. And I say led by all of these because it's a distributive leadership model. So we are all in these tables together talking about what's best for everyone. And that's been a very big difference this time around.
And I think that's to Sarah's introduction around the holistic nature of this work. You know, upward mobility as a concept is really daunting. However, we all talk about silos and how we wish we could work across issues, and this is, I think, the epitome of that. Melissa, you talked a little bit about the power of data that initially got people excited about your first vote, your legislative marker in the sand. And I understand that data also played an important role in motivating your city council people around economic mobility. Could you talk a little bit about how you look at data and how you brought that to life for residents and for your fellow elected officials?
Absolutely. And I want to start by also saying that data is very dangerous. And please don't kick me out, because I'm going to come back with a come to Jesus moment. I did have my come to Jesus moment. But It's very dangerous, especially for marginalized communities, because it oftentimes doesn't lead to the outcomes that.
Say more.
Yeah.
So next week, many of you may not know, but it marks more than 100-year anniversary for National Black Health Week. Has anybody heard of National Black Health Week? Okay.
Not as many people who have been to Santa Barbara. I'll say that for those on the line.
National Black Health Week was started in the 1900s by Booker T. Washington. And his whole theory was that if black people aren't healthy, they're not able to work. If black people don't work, then our GDP and our economic strength as a country fails. And so he used data, right? And had a theory of change, and we're still faced with these same outcomes. Fast forward to a communication that I had at a community event. We finished our CHIP, which is our Community Health Improvement Plan. Our health director walks in, and my district is predominantly African American, and they're the poorest people in the city economically. And he walks in, he presents the data, and he's like, okay, see you guys later. Do you know how damaging it was for the individuals that were sitting in those seats that saw all their lives wrapped up into them being the most unhealthy, the most unproductive, the most the folks that have it the worst, right? And so data can be very damaging. And so when I applied for the Mobility Action Learning Network, I wanted to be in the collaborative and I wanted to be in the collaboration cohort. I'm like, we need to build power. We need a coalition. We need collaboration. So data by decision making, they know, Jesus and Lee, I love them. They knew I came kicking and screaming because as someone with the lived experience of being a part of that marginalized community, we are tired of seeing data without change. All of the statistics and everything that we learned, I already know this. I'm going to tell you what I've seen it, I've lived it, I've had more than 40 years experience of it. Why do we have to keep analyzing and collecting data? But the power of team, right? So important to have a team of folks. I wasn't there alone. And it was a professor at a local community college. We were going through our workshops and talking about utilizing data, and they shared all, we went through the dashboard and very, powerful information. And it's good that I learned from my parents that obedience is sometimes better than sacrifice, because I was being obedient in the moment. Like, trust the process, right? And so I'm there, and this professor said, well, we just really need to ask the people the questions in the community about how this data impacts them. We need to come up with a survey. And I'm sitting there, and I'm like, okay, if part of our survey was, do you feel like you have to move more than 10 miles from your community in order to reach your full economic potential? Like, I've lived in this community for 40 years. I already know what they're going to say. However, what was the aha moment is when we collected the data, we were able to compare our most wealthiest zip codes to what people were saying in the zip codes that are experiencing the most poverty. And I do a convention every year for constituents to set an agenda, right? And so we have a people's convention. We bring everybody together. We talk about, what do we need to fund? What are your priorities? What is your 700 to-do list for the 3rd district? And we did a data walk because of our participation, and we invited members from Urban to come and help walk us through that. And it was such an aha moment for people to see the data that we collected when we had, the philanthropy community, residents, and other policymakers, people from the business community, faith leaders, all looking at the same data. And guess what they said? We need more data. I'm like, so it was the foundation really for the council, and it's rooted in our next strategy, is that now they want to know more. What's happening with individuals, and also what are those solutions that we're going to undertake to ensure that this data is meaningful and that we're going to create a level of change with it. So I'm a convert.
All right, I was going to ask about your relationship with data, and you continued the metaphor. Yeah. I mean, it's really striking to me also, you sort of said this as an aside, but the People's Convention, to be able to set those priorities and breathe life into or challenge what the official data is lifting up is so critical. And
it's
also
a strategy for not being insane. People having you move in different directions. I remember you said you wanted me to do this. No,
yeah, absolutely. And also, I think links back to Frank's comment around buy-in and agency for residents. Yeah. Jackie would love to hear about this breakthrough. It sounds like you're a bit earlier in the agenda in terms of awareness raising awareness around poverty in the community. And now have a framework to organize constituents around working groups. How did you get to this point? What were some of the conditions that led to where you are today?
Several things were going on over the last, I would say, 10 years in Santa Barbara County. I'm only going to talk about a couple of them in the interest of time. One, I'll talk about it from philanthropy first. So, and specifically our community foundation. Our community foundation is 100 years old. We have been, actually, we will be 100, I'm sorry, I jumped the gun. We will be 100 in 2028. Very excited. We're planning our birthday party now, that's why I feel like we're there. And so we were very, as so many community foundations were, transactional. So we work to make connections throughout our community all the time. We make connections to nonprofits, we make connections to donors, we connect donors to nonprofits, we connect government, build public-private partnerships, all about connections. But it was always, for a long time, very transactional, bringing money in from the community, building the endowment and the resources, and then distributing them back out. About 10 years ago, the organization started to take on, lean into this idea of community leadership, which is now a term we all use in the Community Foundation field, where we are using more than just our grant-making tool. We're using all of the tools that we have at our disposal, whether it's convening or fundraising, bringing resources from other places, doing fiscal sponsorships, advocacy, policy. There's a whole variety of things that we've been doing over these last 10 years or so. And there was an effort to build a strategic plan where we would narrow our focus, which is I like a four-letter word in this field of community foundations. Narrowing is bad, but we had to in order to make any kind of a difference. So we ended up with grant making around basic needs, so food, shelter, behavioral health, and healthcare. So we retained the safety net grants to that. We shifted to general operating, and we do 2-year grants now. We also focused on issues that affected the working family. So there was a lot of data at that time, and we were using it at that time when we identified childcare, cost of childcare, quality of childcare, and accessibility, workforce in our community. That was more of a reconnaissance we had to do on that. We did a little bit of grant making. We didn't really know a whole lot about what was going on there. And then housing. Really had no idea what we were going to do with that one. This was all right before the pandemic. I would add one more thing. We established a group that supported the nonprofit sector, because without a strong, vibrant, healthy sector, we cannot succeed in what we're setting out to do. So with the pandemic, what happened was everyone thought, our board especially, oh, you're going to have to divert away from this agenda, this new strategic plan that we have. Well, actually, it was exactly the set of issue areas that we needed to focus on, those safety net issues. We realized the working family was actually way closer to the cliff than anyone had any idea when you saw more people standing in food lines and everything else that happened during the pandemic that we all know. And so our foundation, and really shifted the way that we did business fundamentally. And as the largest community foundation foundation on the Central Coast, second to Hilton, we really had a mandate there to do things differently, and we started to. So that was one thing. The other is that we built in learning and evaluation. It's one of our core values. And so we developed a division of learning and evaluation. We have 3 people in it. And that was very useful in the summit. because we had a data walk as well. And we have someone who is constantly, a team that's constantly looking at the very local level, not Urban Institute like, but very local level. The quality is just as good, we think. But always monitoring trends, working with community, our grantees, people in the community to understand, is what we're seeing real? Is this data really telling the truth? And what's important. So there's that whole piece. The second thing was that we have a group of elected officials now, and hats off to you, because it is key. One of our, somebody said it earlier, poverty is a policy choice. And that is a mantra of one of our county supervisors. It's our issue, and she's so committed to it, and that is what she likes to say as well. So we have her, we have another one who understands, it's our assembly member Hart at the state level, understands that you make $2,400 a month and you're no longer eligible for certain benefits, and yet you can't survive without $8,500 a month in income in Santa Barbara to rent a home. That's crazy. And so he understands how hard that is, and that you need, as someone who's in that circumstance, every time you move to complete your paperwork again, and just what the process looks like. And he's really looking at making changes to that. So I think maybe the word's not enlightened, but a very motivated elected official group that is working side by side in partnership with all the nonprofits and the really hardworking government agencies as well. And then the last is Communify, being that spark, that champion. They're a community action coalition, as I said, or commission, and they work in direct service. The rents, the financial assistance, the Head Start programs, just seeing the poverty every single day and bringing that to the attention of the rest of the partnerships. So the key takeaways for us when all of those things sort of came together is, one, none of us can do it alone, and two, it is not going to happen anytime soon. This is going to take a long time, and there's no magic bullet. So we're going to have to really work on these things together, and the summit was just as you said, the very beginning of what I hope will be a strong partnership that will sustain us for a long time.
The summit is the beginning. You started a 10-year time frame in history, I think, which is really telling. So in a way, maybe more of a benchmark or a catalyst. Sure. I don't have quite the right word. But thank you for each talking about the various roles you play in a collective. If you would, in this next and final section, and start to think of your questions for our panel, talk about how you're thinking about planning and sustainability in this moment, either your institution or collectively. You've got a good thing going. There's so much change. What do you tell yourselves? What are your planning horizons? What do you tackle how do you triage the threats, the very real threats that you're facing at the local level? And sort of just what's your approach? I think that's really what our audience is craving to hear. Anyone can jump in who's willing to start? Well, go ahead.
So we have term limits in Kansas City, and so I'm done in 2 years. Thank the Lord. And so really for me, in this final segment, is really about leadership development.
Okay.
And it's about making sure that, so our convention last year was focused on the hero inside of you, and making sure that folks understand that nobody's coming to save you. You're going to have to save yourself. And motivating them to be a part of the change and not looking to one leader, and understanding that politics is a team sport. Play one position as a policymaker, but we need everyone on the team to make it happen. And so this year we're really focused on blooming where planted. So now that you know that, hey, you have what it takes, we're going to build this team. How do we build our leadership to get this done? And so I've asked all my residents to take a leadership assessment to say, what do you bring to the table? What are your strengths and values? And how is it that we're going to build teams to address the things that you want to focus on? We built the 3rd District to-do list. It's over 700 plus things. that folks feel like if we had 1 year, what's the most important thing that we could do? And so really it's about integrating and making sure folks are not dependent upon one person to carry this through, but we have to have the momentum. And so we meet quarterly as a collective, and our smaller teams work throughout those quarters. But really it's about change management. It's not, when we think about leadership, we think about, oh, we need a champion. We need somebody that's going to get the things done. We're going to have to count to 7, and it's political. This is leadership, and it's about how do we make a change. And it requires us to change our culture as an institution, and that's hard work. Change management takes anywhere from 5 to 10 years to do. And so it requires that, how do we move things forward? So we look to the, what I call the, stickiness, and giving people grace that we're all learning, and what sticks and what are we learning, and how do we do more of what's working and less of what's not working. And so we're in the thick of it, and I think the biggest contribution related to this $500,000 investment is making sure that it's just not the city government that's responsible.
Okay.
We try to do an office of, racial equity and all of that embedded in City Hall, where you have decision makers that are reporting to the city manager about, economic mobility and things of that nature. No, we need to make sure that we're pulling in and really working with external groups, and that their responsibility is to ensure that there is some sustainability.
They're not term limited, not all of them. Yeah.
Yes,
yeah,
they're not
absolutely.
term limited, right? And so how do we start that investment, that first initial investment, and grow from there, and build the stakeholders that's needed to carry the work forward?
700 is a big number.
It is.
How do you think about triaging? You talked about leadership development and an inventory of skills, but when it comes to community priorities, especially at a time of immense scarcity or pending scarcity, what are the filters you're using, and you and your team are using to prioritize?
Absolutely. So those 700, I think, ended up being about 8 or 9 things. Housing was huge. Economic development was huge. And so while they had each, because I asked them to be specific, I need you to be real. I don't want you to just say, we need better housing. Like, what's the specific one thing that we can do? So really focusing on those larger themes, and then coming back together to say, like, okay, now as a team, you have 5 people on your team. What are those 5 things that your team is going to do, right? And so that's how we filter. We try to figure out what everybody's thinking about, what they want done, but they're, obviously in a year you can only do so much.
But it's organized, much like the working groups that have come out of the Santa Barbara Economic Mobility Summit. They are organized. Talk to us about a little bit how they're organized in the carrying
They're
the work
at the
forward.
very beginning right now.
Right.
Because,
Is it topical though?
Oh, yeah.
Similar?
They're actually organized by the upward mobility pillars. So they're actually by rewarding work and quality education and inclusive neighborhoods with opportunities and environment and access to healthcare and
ace the
democracy.
test.
Yes. Thank you. Without, yeah, I don't know how I did that.
Yeah, I think it's
that's
really
how it's done.
it's striking though, because you have the collective sharing the burden, and, and one of the keys to the sustainability of these efforts, from what I'm hearing, is a division of labor, right? But still united under a single framework or North Star that people are committed to. I would be remiss if I didn't ask about, or just re-ask about, the headwinds, the threats. How are you navigating that today? How are you planning? What steps are you taking that you're willing to share in a transferable way in a public forum, that you advise other community leaders to be thinking about that's working for you?
I will say first, data. right? Use data. Don't be afraid of data. Use data, but don't overuse data, right? Diversify, sure. But at the same time, recognize it's not a community champion, it's community champions. The more people that you have that have a stake in the game, the likelihood that this will continue increases exponentially. And I think that idea of diversifying the work among the pillars, it's something that we're doing, but again, it's letting people play to their strengths. Each of our pillars is led by a different organization. And then within that structure, there's another organization or a coalition or a work group that serves as the engine to drive the work. So we've got a backbone and an engine for each pillar. And all of that funnels together to a regional leadership team. So having this kind of diverse structure, we're in that season, it's spring training. If you're familiar with the poem Casey at the Bat, right? If you're waiting for that one super slugger to come and win the game for you, then when that person strikes out, the whole thing goes away. And if you look at, the moral of that story is the two people that were ahead of Casey in the order actually got on base, and they weren't expected to. So finding the unexpected light in the work is critical too. Finding help from places that volunteer to help out, that maybe you didn't think of in the first iteration, and allowing them space to get into the room, allowing that voice to come in. And knowing, again, back to the data, I can't not emphasize that, because that's where my involvement started with. I was part of the data work group on the Opportunity-Rich Neighborhoods pillar. And my colleagues from the other organizations, we still, even though we've kind of set up our work there and created a template for the next pillar, which Chamber RVA is going to lead, rewarding work, we still talk to each other, and we still interact with the teams from the other pillars. Yeah. So even though it's not our job anymore to work on that, we are still engaged with it beyond the lifespan of what our original work product was.
Yeah. And so the beauty, real quick, the beauty in being an elected official is that you can say the things, right? And in the climate that we're in, we're going to need somebody to say the things, right? And so we have to be organized around who's going to take on that mantle, because unfortunately a lot of folks are operating in a realm of reality and fear, in which they're having to make really hard choices. But we as a culture cannot lean into erasure. And so if we're going to do that, we have to mobilize and decide who's going to say the things. So it's important that they continue to be said.
Thank you. And thank you for your leadership, both in Kansas City and taking your time to be here in DC. All three of our panelists have had multiple trips to DC, which I think in the last couple of months, which I think is a testament to the link between place-based work and the national conversation and the national realm. And so I just want to commend them for that, but also remind us that we are us, right? Is one of the themes from the first panel today. This is a collective project. Does anyone have anything to add as far as how they're thinking about, well, let me say it this way. As you're getting your questions ready, for those of you who weren't here earlier, on your tables is a QR code to submit questions. We're not doing mic'd questions in the room. That way we can collect them all here on this iPad, and I will feed them to the panelists online. You can use the virtual chat. So my last prompt, I just want to make sure you each have a chance to give some advice or share a habit or an approach that you're taking to sustainability of your work. Specifically, if you can focus on economic mobility, that would be helpful. Anything else to add?
Well, I'd go back to the previous question, and it sort of ties to this one too. The work groups are one part of this, and the idea of them is not to create more work. It is to help create, to figure out what the predictors are in our community, to understand what our resources are, who's doing what, building on the great work that is already going on, and recognizing that we're starting where we are and starting with what we have, which is not bad, it's good. But there are gaps, there are weaknesses, obviously, or we wouldn't have the statistics and the data that's showing what we have. So the work groups for us are about two things. They're about developing this narrative, defining the predictors, and maybe presenting a policy and advocacy agenda that we can really make some significant change together. But we're really building on the work that is happening in our community every day, not necessarily creating new work. And then the other differentiating factor is that we now have a clear unifying vision that we are working together under, which we didn't have before, hence the silos. So those two things for us, I think, are really important in thinking about sustainability. I love leadership development as a community organizer. That is key. But it's as important in the institutional and organizational level as it is at the individual level as well. So those are some of the things that I would add to that previous conversation. As far as the headwinds go, going back, I know, but we have huge headwinds with the majority, with 59% of our nonprofit organizations getting federal funding, and 40% of their contributions are coming from government sources. So there's going to be significant gaps there. We know the impact to individuals. We heard it earlier. It was so many of the programs that are going to be cut. And then just when you have that increase in demand for those services, and the nonprofit community, especially government too, but nonprofit community having to scramble for additional and alternative resources to actually meet that demand, it feels a lot like COVID. And so what I would say also is that we are not treating this scenario as something extraneous. This is a disaster, and we just went through one. This is just another one. And I said it. And the idea in disasters, you don't want to be passing business cards when you're out there for the first time meeting other people. This is really about building those relationships, those connections, those that social capital that you're going to need, not just in this disaster, but in every other one that's going to come down the pike. So it's a part of the process, and that's the way I think we are looking at it.
Thank you for sharing that and for saying the thing. It is clear to me, and hopefully to you all as well, that none of you are strangers to to uncertainty, to scarcity, to threat, and I think it's a matter of hearing from each other how we are approaching this and getting through. We've got a couple questions to that end that I want to get from the audience out onto the floor. There are two around balancing priorities, and specifically people are asking about a little bit of the conceptual distinction actually between financial security and economic mobility, in particular for residents as they prioritize their sort of hierarchy of needs. How do you approach that in community, and how have you been able to keep your eye on the prize of mobility as something aspirational?
So for us, it is really rooted around, I was very clear with my colleagues around what this small investment is supposed to do, and that is to move people from $14,000 a year to $60,000 a year. So I think that specificity is really critical and important. If that's the median income of individuals who are living in Kansas City, then that's what the goalpost needs to be. And oftentimes we get caught in really great programming and great solutions, but it's really not making a significant difference in the lives of people that in a way that moves the entire community up. If our aim is for everyone to move out of the 3rd district, which is said oftentimes in every urban area is, well, I just need to get out. I need to get a job. I need to move away. I need to get out. I was meeting with my best friend, high school best friend, and she said, I got tired of getting up, going to the floor because of the rolling gun battles in my community. I had to leave. And so if that's our aim, then we can't have a smattering approach of really good programs and not focus on how is the rising tide going to lift these boats in this community so that there is a sense of power and sense of belonging and a sense of economic mobility for this set of people. And that's why I love the conversation that was happening earlier with, I think it's Tanya, who talked about a population management approach in the healthcare industry. We talk about, you know, how do we work with this population? So that's how I'm seeing it. And just really quickly to your last question, I think one of the most important things that we need to do, everyone needs to in this room do, and that is to publish. We have to have a record of what's happening right now in this moment, what we're doing, what we're trying, what's working. We all need to be really thinking about this and making sure that we're partnering with Urban, and they have lots of researchers out in the community that are making that record and are publishing our results. I think that that's really critical and important.
And that is to the point of telling the story. We also, speaking of research that you might find relevant in this time, the Urban Institute Center on Nonprofit and Philanthropy has been doing a lot of rapid response analysis about the health of the nonprofit sector down to the congressional district. So I urge you to check that out if you haven't already. And so back to this question of this tension that we've heard time and again about surviving, thriving, or mobility, stability. This is an age-old tussle at the local level. Do you even get into it, or do you have? And what is? How do you get through the semantics and truly conceptual differences to be able to make progress?
We were talking about that back there. Like you don't run away from it. You run towards it, right? And it's you have to adopt a yes and model with everything. And really what I mean by that explicitly to this is that you have headwinds that you're working against, but you also, because of those headwinds, have new opportunities that weren't there before. And finding those champions to play into that becomes, in some ways, even easier as people react, as you tell the stories, not just with data, but really those personal connections, using those relationships, getting away from the transactional behaviors to make this about people. Because at the end of the day, there are very few of us out there that really love just the numbers. The numbers mean something. It's the people behind the numbers. And that's what everybody that we're trying to reach, they're trying to reach people. They're not trying to reach numbers.
So I was thinking about, as I was thinking about the upward mobility framework, and actually we have a vision at the Foundation for a Thriving Community for All, and we were thinking about adopting the upward mobility framework as our framework underneath that, because we've been looking for a dashboard and have been creating our own. So that's something we were thinking about. But as we're thinking about all these really big picture, high level things, I was also thinking about someone that my son had almost adopted in Baltimore. He lives just outside of DC for a long time. And he's someone who's grown up in one of the most struggling neighborhoods in Baltimore. And he has had, just getting him through high school, trying to get him focused on school, staying away from the pull of the streets, which was so, so strong. Trying to teach him how to drive so he has access to opportunities all around the city. Nobody's there to do that for him. How many hours do you need to learn how to drive? A lot. Who's going to do that? Getting out of high school, finally, yay. Getting a teeth decay, needing that access to dental work, nowhere to go, $8,000. Then having to get a job, no suit, nobody to connect him to any resources there. Finally gets a job, finally gets a car gets in an accident, he gets in an accident, setback. I can't tell you, the list goes on and on and on about the setbacks in this one child's life from the ages of 14 to 23 that have just been eye-opening, to say the least, devastating. And if it wasn't for a network of people, he would not have gotten through. So thinking about this it's dimensional work. We have to think of it at the scale, the individual scale, at the community scale, at the regional and national scale. We have to think about it in temporal. We have to think about it short term, midterm, long term, and we have to iterate. So it is not a one, as I said, no silver bullet. It's not a one size fits all. It is personal. And we ultimately have to create these policies and practices that are going to get us all there. So,
Thank you, Jackie. Final thoughts, Melissa, before we wrap up?
Thank you so much for having me. Thank you for this opportunity. We're one of the things that I say daily, we're going to make it. We're going to get through this. But it is going to require us to be organized. It's going to require all of us to step into our leadership. Leadership is just not going to be that person at the top, but everyone, if we're going to create change, has to operate in their lane of leadership and to make that change.
Absolutely. I challenge myself, we have 2 young kids, to put it in the language that children can understand, and their school counselor uses this mantra in the classroom is, we can do hard things.
We can do hard things.
And so with that note, I want to thank you all for joining us today. For those in person, we've got a networking reception that follows. Please join me in thanking our panelists and all of our speakers.
Thank you.
Thank you.
Thank you.